Good evening, everyone. How's everybody doing today? Hey, thank you for the response. I appreciate that. I love seeing everybody's smiling faces. Hopefully, you had a wonderful holidays and the start of the big holidays coming up. You already know, and I know the kids is like making the list and everything. But I just want to welcome everybody out to the Small Business Conversation Proposed Flavored Tobacco Regulation. I am City News from iHeartRadio. I'm your moderator. You can give a round of applause. You ain't got to if you don't want. It's okay. I mean, I appreciate it. But I'd like to welcome everyone. And with that being said, I would like to turn over to Councilmember Shayla Favors.
Well, good evening, everyone. As you all know by now, I feel like we're all good friends. My name is Shayla Favor, and I have the honor of chairing Columbus City Council's Health and Human Services Committee. My colleague, Councilmember Nick Bankston, who chairs our Small Business Committee, is on his way, and we will provide an opportunity for him to provide some remarks when he arrives. Thank you all for being here tonight at our third small business conversation on the potential regulation of the sale and distribution of flavored tobacco products within the city of Columbus. To date, we have had multiple meetings with stakeholders, 4 opportunities to hear from our community, as well as feedback from the number of emails we have received. We are listening, and last night we shared Council's proposed amendments to the legislation. In the draft, feedback provided by all residents throughout our engagement process are taken into account. I will reiterate that this is only a draft. Our city attorneys continue to debate other exemptions and the legality under Ohio state law. Additionally, we continue to work with the Board of Health on increasing penalties based on feedback we heard from this group specifically. Shortly, you will hear from Chris Maitland, who is in Council's Legislative Research Office. He will walk us through the proposed amendments, and after, we will open it up for public testimony. Thank you to everyone who has signed up to speak in advance. If you would like to sign up to speak, you can do so at the registration table behind you. If you do not want to speak tonight but would like to provide written testimony or feedback, you can still email flavoredtobacco@columbus.gov. We are continuing to read every single email and taking it into account as we decide how to move forward. Additionally, tomorrow we have a second public hearing, December 1st at 5 p.m. in Council Chambers. With that, it is my honor to turn it over to our Assistant Health Commissioner, Edward Johnson.
Maybe. No, maybe I can figure this. Can you guys hear me? Yeah. Oh, perfect. I did figure it out.
Just in case. Mm-hmm. I apologize. I should have said this. Earlier today, Columbus Public Health hosted a press conference regarding a measles outbreak in our community. I have asked our Assistant Health Commissioner to provide you all with that update on the outbreak that is happening in our community. I know that we're not here to talk about measles, but this is a public health conversation, and I think it is pertinent for us to continue to spread the word, not the measles, as much as possible. That was a joke, and y'all got it. Thank you.
Yes, please, no more spreading measles. As Councilmember Favor alluded to, Dr. Roberts and Columbus Public Health hosted a press conference on the local measles outbreak. We are currently, I believe, at 48 cases of measles in our community, the overwhelming majority of which are in individuals under the age of 5 who are currently unvaccinated. We have had a number of cases in individuals over the age of 5 who were either unvaccinated or partially vaccinated. And so this is something that we encourage folks to make sure that if you have young children, that you are up to date on vaccination. The recommended pediatric schedule is at 12 months and then at 4 years of age before they enter school. We want to encourage folks to be diligent on our website, and I believe through multiple news outlets we've shared 3 locations that if you were at those, we know that there has been general exposure to the public. So if you go to Columbus Public Health's website, you can see those locations and dates and times that we would ask folks to monitor for symptoms. And if you have questions, to either call the health department or to consult your primary care provider if you have any questions on that front.
What if you are a person who is vaccinated? Do you still need to take any additional precautions to take care of yourself during this time?
the measles vaccine is very well established and very effective. It's 97% effective when you are vaccinated with both doses. That being said, if you are spending time around someone who is immunocompromised, their immunity could be less than that 97% effective rate. And so one thing that we do recommend is high-quality masking if you feel that that is appropriate, particularly if you're spending time around young children who aren't vaccinated, can't be vaccinated, or individuals who are immunocompromised. And on to tobacco. First of all, thank you, Councilmember Favor, yet again. We are very happy to be here to have these conversations, to talk about the public health situation as we see it, but also to engage with our partners and our licensees and businesses. We've had the opportunity as public health to come to all of these hearings and conversations, but also to have meetings with representatives of the licensing community and of the vapor trade community. And so we appreciate that, and I think we've gotten some feedback that I think could be helpful, as you mentioned, in terms of higher penalties to get bad actors out of the game, and some other ways that I think that we can share information with the community to make sure that we're being transparent, or as transparent, even more transparent than we can be with how we regulate tobacco in our community. So we're just grateful to be here, and we thank you for that.
Thank you.
I thought we was just passing it on down the line. Sorry about that. Thank you once again, Ever, for that. Appreciate it. At this time, we turn the floor over to Chris Maitland, Legislative Research Office, Columbus City Council. The floor is yours, sir. You don't have anything, you can just start.
Oh, sorry. Oh, all right. Thank you. Sorry. We don't have these mics at City Hall, so they're a bit new for me. Thank you. So just to go over briefly, City Council's proposed changes to the flavored tobacco ordinance, which is introduced as ordinance number 3253, 2022. To begin, just want to do a brief discussion of what CPH proposed and what City Council is amending. CPH's proposal defined flavored tobacco. It prohibited the sale of flavored tobacco in the city of Columbus. And after that ordinance would be passed, Columbus Board of Health would do a number of rules, including adopting the definition of flavored tobacco that was passed by City Council, enforcing the prohibition against the sale of flavored tobacco, change the retail license to sell tobacco in the city of Columbus from $150 to $350, change the civil penalties for violations of selling flavored tobacco to $1,000 for the first offense, $2,500 for the second offense, $5,000 and loss of license for remainder of the licensing cycle and next cycle on a third and additional offense. City Council's proposed changes would clarify that all flavored tobacco products would be banned beginning on January 1st, 2024. There would be an exemption for hookah lounges. They would be able to sell flavored tobacco products provided that they were licensed to sell tobacco in the city of Columbus. They followed all local and state laws, and that these flavored tobacco products were consumed on the premises. Another proposed change would allow wholesale dealers, distributors, and vapor distributors to sell and distribute tobacco products only in a distributor or dealer capacity, which means that since they do not sell these products to individuals, they're just warehousing them, storing them, they would still be able to do that. And also City Council will continue to work with CPH on the appropriate fee and license structure. And those are the City Council's proposed changes so far to the flavored tobacco ordinance, and we look forward to hearing from your feedback and many others over the course of this discussion. Thank you.
Thank you, Mr. Maitland. At this time, we're going to open up discussion. When I call your name, you will step up to this mic right here to the left of me, the right of you, and you'll have 2 minutes to speak. We ask that you adhere to that time. That way we can get everyone a chance to talk. As you're talking, if you can try to make contact with me, I'll let you know right when you're about at 30 seconds so you can kind of like wrap it up. And that way when I say time, I'm not cutting you off. You actually have your time. And please, anyone who's sitting down, once you actually hear someone say something in the council member or Edward or Mr. Maitland actually answer them. If you please could just keep your comments to yourself until it's your time to come up here, because I want to make sure everybody's heard, because everybody wants to be heard. You have 2 minutes. It's a long time, but it's not a long time, but I want you to make sure you get all of your 2 minutes. With that being said, floor is open up to discussion. The first person I'm calling up to the mic is Samir Hazim. Samir. Simmer? Hazim? Okay. Next person we have is Rima Cotroy. Rima. Gala Rawan? Gala? Tay Darwish. Michael Olawinki. Frank Cahall. I know he's here. Please give it up for him, please. Sir, you have 2 minutes.
So first, I have to say that my testimony for tonight is totally changed after the announcements today on the proposed changes. And while I thank council for making a change to make the equality between the menthol tobacco ban and the vape ban the same now, instead of vape being 30 days, we with Ohio Vapor Trade Association and also the retailers that are vape only here in Columbus still disagree with the policy of banning flavored vapors. You know, we have through this whole cycle, we have asked for stronger penalties. We have asked for the employee that makes the sale to be fined like they do in Louisville. We have also asked, when we were speaking with Board of Health last week, and thank you again for the meeting, that we carve out vapor products in the city of Columbus to 21 and up, vape-only stores where 70% of the sales come from only vapor. Now, that being said, I can talk specifically about my store, Alt Smoke. We've been open for 11 years. James Jarvis, who is sitting back here, his store opened 3 months after ours on South High Street. And Sarah, who her husband and herself were customers of mine at my High Street store, they've been in business for over 9 years, but not quite 10. During that time, the three of us have also been board members, vice presidents, and presidents of the Ohio Vapor Trade Association. We have proposed through the state with many things. You know, we supported Tobacco 21. We supported the CPSC on child safety caps and all these things to make what we do safer, not only for our industry, but for the people that purchase our products. That being said, all three of us and also the other vape retailers that are here, we all use minor decliners.
Thank you.
Sir, thank you so much. I apologize. I came in the middle of your presentation, but I appreciate you being here today. I appreciate your engagement with us through this process. The one question that I have, and I think it would kind of be for a lot of the folks who represent the vape shops, is that there's been a conversation around good actors and not so good actors. And a belief that, to your point, that it has been the vape shops that have been the most responsible pertaining to Tobacco 21. When we meet with health officials, not advocates, health officials, they tell us a little different story in terms of some folks not being as compliant. Can you kind of talk me through that part of the good actor versus bad actor, where vape shops were all good actors? Just talk to me through that.
So I can discuss from the OHVTA side and from the shop sides, especially mine, Sarah's, and James. One of the things with OHVTA that we got added to the 21 ban and also the change of the tobacco law was that it requires stores to use a minor decliner. The minor decliners that we use not only scan the driver's license from all 50 states, it actually saves every single scan so that I can go review the store. Sarah and James's are the same way. James's POS system will not even allow a sale unless that driver's license is scanned, and also Sarah's as well. I use QuickBooks, so I have to rely more on employee training and also my minor decliner that I can log into and go look at the scans and compare them to my sales from that specific day. Also, with OHVTA, and James can say, every single month while we've been vice president and president, we go to the FDA database. We run the state of Ohio, and we see who fails those tobacco compliances. James and I have been known to reach out to even non-members to see if we can assist them in that not happening again, because OHVTA wants every vape only, and that's where we also need to make it, that we're vape only. We're not a mixed-use tobacco store. We're not a C store. We don't sell gas. We don't do all these other things. We are vape only. Does that answer your question?
It is. It's very helpful. And I was wondering, now I want to put it on the health department to give a rebuttal or just close this loop, because there seems to be some discrepancies in what we're being told. But thank you so much.
Well, the discrepancy also with the city is what is a true vapor-only shop and what is a mixed-use store. Whether it is, vapor only, whether, some stores call themselves vape, but they also sell tobacco, they also sell head products. So when we look at the data, and then to the discussion that we had this afternoon, is that as the vice president of OHVTA, I can't go in and look at those inspections so that we can offer training and help people that fail. So.
Thank you.
President Harden, I think to what you're speaking to, over the life of our program, and I know that I had said this, I believe, 2 small business conversations ago, where we kind of spoke to this 36% non-compliance rate over all licensees. With what we pulled out and how vape facilities were defined, that non-compliance rate was at 35%, looking at as those stores were defined. And so for us, statistically, we said, well, there's really not a discrepancy there. I think some of the conversations that we had just recently had about how do we share that data and how do we put that out there, I think we have a model with our food licensing program where you can go in and look at a restaurant and see, okay, not so great inspection report here, but they were able to remediate or it triggered another follow-up. I think that's something that we're also going to be looking into, being able to post publicly as well to say, okay, we're starting to, thank you, my apologies, I'm not good with these. Being able to put that information out there, but for us over the life of this program, at this moment in time, we're not seeing a difference in compliance rate, a statistical difference in compliance rate between vape-onlys and the general licensing.
And we consider vape only the same way this gentleman is explaining vape only, being literally vape only, no sales of any other type of tobacco, or are we doing vape only versus convenience stores and gas stations?
I would say we're doing vape only versus convenience stores and other licensing. So when our team is going in, they're kind of making that assessment where they kind of look around and say, this is the only product we see based on that field observation.
And that's why, to our conversation, is that we have asked for that to be public and also to see the past, we've requested the past ones, so that we can help the Board of Health identify what is a true vape shop versus a mixed-use store.
Thank you.
Thank you. At this time, John Scott. Mr. Scott, 2 minutes.
Thank you. Good evening. My name is John Scott. Thanks for the opportunity to speak again. As he said, we appreciate the increased notice date of effect of this from 30 days to 12 months. I'm glad you're listening. However, the end result is still the same. We'll still have to close our stores being a vape-only store. and these products have helped so many people transition off of more harmful products. They'll be taken off the market, basically. There are better ways to accomplish this, we feel. Has any research been done on the Toledo legislation that passed in 2019? What does that data show?
Referencing, well, first of all, let me allow you to complete your
So I'm
statement.
curious what that data shows. Obviously, what they did was allow specialty stores where their sales are 60%. I guess you already know what it is. We think that's a great policy and helps thread that needle to allow adults to still have the products that have helped them and allow the small businesses to stay open. Allowing flavored products to be sold in specialty stores that require customers to be 21 years of age will significantly help with the youth vaping issues, allow adults to continue to use and transition to less harmful alternatives, and also make it easier for the Department of Health to manage compliance since there'll be less stores selling these flavored products. New York banned flavors. Youth tobacco increased by 12.7%. This is 18 to 24 years old. Massachusetts banned flavors. Youth tobacco use increased by 7.4%. Rhode Island, youth tobacco increased by 5.7% after their ban. We are told this is about public health. We not only fear, but know that hundreds of thousands of people that use electronic cigarettes in Ohio will switch back to more harmful traditional tobacco. That is the true health crisis if this were to pass. And that's obviously from those statistics I gave you, that will happen. Thank you. Then comment on that.
In my initial remarks, I discussed, or I mentioned that we continue to explore other exemptions that could be a part of the legislation that is before us right now. And that discussion is happening at the legal level. And, you know, our city attorney has a job to defend what we legislate here at council. And if they are unable to see that pathway forward, regardless if another city has done it, even if it's another city that's in the state of Ohio, they will not advise us to move forward in that direction. So since you made that recommendation to us, we literally have been running that up the chain. So we continue to listen and explore all of the ideas that are coming from these meetings. But if our city attorney makes a different decision, then we have to take that advisement under serious consideration as we move forward.
Understand. I think that the Toledo legislation is, the way it was written, makes a lot of sense to us, along with the increase in penalties. Less stores selling the product allows for compliance to be much easier. We hope you really will take a look at that and adopt that policy.
Please.
Still trying to get smarter on this issue as we legislate, and this is, for me, part of the listening and trying to understand what are we know the intended consequences are the intended outcome that we want, which is to stop the next generation, especially children, being hooked on tobacco specifically, but also trying to understand what really will happen. And so looking around the country when folks have not exempted vape shops, I'm assuming that those folks, especially adults who use vapes, they still will try to get a flavor into their liquid. So what I'm wondering is, what does happen to a vape shop that sells flavor vapes? What have you heard from around the country? Not just that it will just shut down, but is there something else? Do people end up mixing vape, and is that what happens?
So Frank has stores across the country in states that, yeah, I mean, the vape shops close. And then, like you said, people still try to get their hands on, either they try to make it themselves at home by ordering the nicotine, the propylene glycol, the vegetable glycerin, and then the flavoring, or most of them just switch back to traditional cigarettes and then go down that harmful path. When COVID hit and we were forced to close our stores, a lot of our customers went back to tobacco for a while. We saw an increase in sales as people stocked up when they heard that we were going to have to close, and who knew how long that was going to be. But once they ran out of those products, their choice was to go back to tobacco. The FDA has enacted policies recently with delivery of internet sales, so it's really difficult to order anything off the internet, and that has decreased the youth vaping by over 50% in the last 3 years. So we think there are policies that can help without having to shut down small business and take away these products from that have helped adults. Thanks.
Thank you, Mr. Scott. At this time, the floor recognizes Sarah Rutland. Ms. Rutland, you have 2 minutes.
I want to thank Columbus City Council for the opportunity to speak again today. In the 8 years that Top Notch Vapor has been open, we've helped nearly 20,000 adults quit smoking, and we are very proud of that. Because we're a specialty vapor store, everything we sell is either flavored vapor products or a component of a vapor product. At my store, you must be 21 to enter without exception. Customers are greeted when they come in, and we immediately ask to see their ID. The median age of my customers is 46. Nearly 40% of my sales are from customers aged 36 to 45. We have this data because we use third-party verification. Specialty vapor stores are in a much different position than convenience stores and grocery stores. If a flavor ban were to pass, it would force us to close. We have no other products to sell other than to stay in business. And because of that difference, we are strictly 21 and over establishments. The decision was made a few years ago to exempt specialty vapor stores from the indoor smoking and vaping ban that happened a few years ago. As lawmakers, you can tailor the language and enforcement to truly benefit public health while limiting youth access. Identify specialty vapor stores as any store where greater than 61% of their sales carry vapor products. Enforce 21 and older to enter, and make third-party age verification mandatory for vapor shops. We provided your offices with the final language of the Toledo flavor ban. It was successful in accomplishing a common goal: reduce youth access and therefore use, while leaving these harm reduction products available for adult smokers and former smokers. There are 9 specialty vapor stores in Columbus. That number of businesses is easier to manage for enforcement. I truly hope there isn't a ban of flavored vapor products. A complete ban on flavors will have a negative impact on public health. But if access is a compromise that needs to be made to keep safe and local access to these products for our adult consumers, we would definitely urge you to look toward Toledo and exempt specialty vapor stores from a flavor ban. I've emailed several of your offices for meetings. As a business owner and a board member of OHVTA, we would like to continue this conversation further. I think that we can get together on that. As a 43-year-old woman, I value all of my choices, and over 10 years ago, I chose to quit smoking to use a healthier alternative, and I hope that I can have access to the choices I want to make for my health. Thank you.
That was great. That you were a little over, but I felt the wrap up coming, so I was like, Ms. Rutland, you got it. Great job. Anyone?
Dialogue we had last time. I'm happy to answer any questions that you guys might have.
You mentioned something that I don't think I've seen or heard is around the age restriction of entering into event. Can you elaborate on that more and how that works?
Explain to you what we do. So we have a fairly large shop. When people come in, we say, hey, how are you doing? What can I get you? Hey, can I see your ID? If they don't have their ID, let's say our customer goes out to a car and someone from that car comes in with their ID. We refuse a sale to that adult person because the person that they are with does not have age verification. I am a mother, 2 boys, 22 and 27. I said it before, they don't use tobacco products. They know what it did to me. They know what it did to my parents. You all know that my husband, both of his parents are dying from smoking-related cancer right now. We have the same goal. I can't stress it enough. I don't want kids to use these products. I supported T21. I felt like it was common sense. If we can get 18-year-old seniors to stop having access to this and bring it into our schools, that's one step, and it's working. We just need to keep these products available to adults like me who used it to help save our life, because I am currently watching 2 people die from it.
Thank you.
So, this conversation, as I've said many times before, is happening not just regionally, so around Columbus, but nationally too. And literally just heard a report on NPR 2 days ago where they were talking about a national model to address the issue around our youth using vape. And one of the young folks that were interviewed talked about his addiction to vaping and how it impacted his ability to engage in sports and things of that nature. And so what we have provided space, I believe, throughout these conversations is the reality for many people that it has saved you from smoking traditional cigarettes, right? But there are harmful impacts associated with vaping. And I'm wondering, Edward, can you center us once again as to why we're here? Because we have heard from many of the business owners who are also users of vape that it has saved them, but there are negative health impacts to vaping, and we're seeing it in our young folks.
Absolutely. Councilmember, thank you. I would refer, and I'll lean on the testimony that I think you heard at the last hearing at City Hall from the medical community. You know, Dr. Christoulis from Mount Carmel Hospital System kind of spoke to what happens when you kind of superheat a lot of these liquids and how the chemical reactions can interact, and you're inhaling those vapors that are containing chemicals that are not always the best things for individuals to be inhaling. I know that Dr. Christoulis mentioned, you know, at times there has been formaldehyde as part of some of the recipes, shall we say, for some of these devices. And so I think there is always that distinction of would we in public health use the term healthy or more healthy to describe these products? And I don't think that's something that we would use to describe it. Would we say it's a harmful activity? Yes. Would we say it's potentially less harmful than combustion tobacco? Yes, as well. But that doesn't mean that we would say it's a not harmful activity. And I know that there's the discussion around smoking cessation, and I know that there have been multiple studies from FDA and others where they speak about kind of the less harmful effects to it and the potential for it to be used as a smoking cessation device. And I emphasize the word potential there because for us in public health, what we have to go by is the ultimate certification that it is a smoking cessation device is FDA approval for that usage. And so as public health, for us, we can say, yes, we are happy to hear these stories, and we don't discount them, and we don't want to dishonor them. But for us as public health, we have to go based on that science-backed review, which says this is not the intended use of this product, which is smoking cessation, which is to stop the activity, to stop the nicotine addiction.
So I'm wondering, yes, and I was actually getting ready to come right to you, because hold on, I gotta get my question out. My question truly being is there conversation happening at the manufacturer level around going through the FDA's process to become an actual cessation product?
Okay, I'll answer that one first, and then I'm going to jump on to what the other discussion was. So, as an industry, companies test their e-liquid. We test for acetylpropanol, which can be a precursor to diacetyl, which we all know, popcorn lung. So since 2000 and, am I right, James, 16, our stores and our companies, including two of my family companies that are manufacturers, test every product that we bring into our stores. We ask to see the test data for especially those two components. Now, about to the safety. We call it harm reduction. Other countries, unlike the USA, have actually jumped on the bandwagon, including the UK. Now, Health England and Health UK, kind of like our FDA and our Doctors Association, both did separate tests. They came to the conclusion that vapor products were 95% safer than traditional tobacco and labeled it as a harm reduction product. When we bring that data, and it's a 500-page report, we are constantly told by states and cities, that's the UK, we don't care. But the data's there. The data's being ignored that vapor is a tobacco harm reduction product. To the point that in UK hospitals, if you're an inpatient and you smoke, they give you a Cigalite. UK hospitals now have vape shops where the doctors send the patients to get an electronic cigarette. And I think right now, James, what is it? There's 9 total in the UK. UK hospitals even have signs on the door that says smoking's not permitted If you use a vapor product, feel free to use it. But the difference, and like she just said, the UK's universal health care. They know exactly the money they can save. Whereas we're pay for play. And I'm not ashamed to bring that up at all. We are pay for play. We have drug companies that want you to use their products over ours. And it just blows my mind the difference between some other countries and their testing. Now, the UK has gone even further. They've limited the size of the liquid bottles. They've done all kinds of stuff. The EU also as well. So,
The FDA has asked them to, right?
we all did file for our PMTAs. They blanket banned them. We're up to 16. We're up to 16 companies that sued the FDA and have had their MDOs rescinded and is forcing the FDA to redo the data.
Yeah. Okay.
Also, when we filed with the FDA, that was in September.
Okay.
The FDA changed the process of what scientific data they wanted in January the following year.
Just for my company alone, 13 million pages of data.
Okay. All right.
After 1 year, blanket ban.
Thank you.
Everybody that filed got banned.
Thank you.
After 1 year.
Okay.
Thank you.
Sorry.
Thank you.
Thank you so much. Appreciate that. Did you want?
Question, City, for the Health Department. So as we talk, so for me, this is difficult, this part of the conversation, because I think there is a line between our responsibility for health and the liberty for adults to make decisions for with their body. I do think there is a line. Now, I think that the health impacts have to outweigh those liberties sometimes, and thus a ban or a non-exemption would come up, specifically when the end goal is to stop young people children from getting access to these products. When we do our enforcement, so the enforcements that we've had, that you've given the data on, how many of them had the 21 to enter as a requirement that failed?
Which is part of the reason we asked for that.
Okay.
So I think as part of that, if they had 21 to enter, that's not necessarily a distinction that we have, but we would say that was an attempted buy that we could not execute. So that would be a compliant establishment. If an individual, if one of my team tried to go in as an under 21 and was refused entry, we'd say, great, you're doing the right thing. We were not able to make a buy. You are compliant with the laws of the City of Columbus. But as a collection of that, as a subset of data, just refused entry, we don't have that. We would just call that an attempted buy.
Thank you.
Okay, we're moving on. Right now, the floor recognizes Saheed Malik. Here you go. Way to wake up a little bit, people. Appreciate that. Mr. Malik, you have 2 minutes.
Thank you very much, the council gave me the opportunity to speak. I've been almost every meeting and listen everybody. And I just want to go talk a different aspect, like economics impact to the families and what city have planned to help those people who's going to close down their stores, how they're going to do leases, how the legal proceeding will take places, and what grants or money those people can be awarded against those businesses closing. And my thing is unique. I'm right on the Gahanna and the Columbus border on Morse Road. Like on my cross street, everybody sells everything. And I would not sell it anything because I'm in Columbus. And my lease is until 2040. So I just remodel my place. I spent like $250,000, and if I knew it's a ban coming, I would not do it. And another thing, the city of Columbus, honestly, didn't reach anybody. They just make their mind they want to do it, And I've been every meeting, my email, my everything is there. They never send me any information about meeting or anything. And I think this is not right for the people who trying to live their life best. We should not ban them. We should not, people giving people choice what they want to do it. And I think even this proposal should be subjected to FDA approval, or we should wait at more data, like people talking, and look at more better and more in depth before we do that one. And we all happy living, the Columbus is a great place, it's growing 10th best city in probably in US, but those things, they're gonna put us down. Oh.
Thank you. Well, hold on one second. They want to talk to you real quick.
I'm sorry, and can you tell me what kind of store you have?
I have a gas station.
You have a gas station, and
Yeah.
you believe that this ban will put you out of business?
I think so. Because I'm right on the border, and all other places just cross street from me, from Morse Road, they are in Gehenna, and they have opportunity to sell all those products.
What is the percentage of your sales that are dedicated to gas and flavored tobacco?
Flavored tobacco, I sell like a 50%, more than 50% I sell flavored tobacco to my entire sale. Like if I do 100,000 sale a month, $50,000 sale is the flavored tobacco and cigars and vape and everything.
Outside of gas?
Outside gas.
So they just come to your store for tobacco?
Can you repeat your question?
So are they're getting gas, they're getting snacks,
They're getting gas,
and they're
but,
getting...
but as a convenience store and a retailer, I'm in this industry for 30 years. For a retailer, from the cigarette, there's no money. There's an 8% margin. Everybody's selling at 8% margin, and we are selling under our cost because those money should be coming from the manufacturer, and we don't know when it's going to hit us.
So recognizing that, there could be an impact for businesses, we have at council been exploring, what does support potentially look like?
Support, I mean, you guys raising the license fees, which is not right, I think. Plenty you guys raising is a harmful. And I think even you guys want to do the ban, you should raise the state minimum, like beer and wine on the cigarette. Maybe people can survive on those places.
I'm sorry, you're talking about the license fee is?
No, I'm talking about the retail prices.
You said something, you mentioned the license fee being too high.
I'm talking about license fees. They just raised it like 3-4 years ago.
Okay.
And now they want to propose like $350. And the same thing with the penalties. And we used to have only one cigarette license. Now we have to have a health cigarette license too.
Well, I will say that those conversations and those changes have come from these meetings. They have come from the folks that have attended the last 3 to 4 business meetings that have, hold on, sir, that have stated that they want to see those bad actors be severely punished for selling to underage individuals and so on and so forth. And I do believe that if we are committed to addressing a public health crisis, that our penalties should not be equivalent to a parking ticket. So that's why you're seeing these numbers as they are reflected today.
I do agree with you, ma'am, but the data showing the teenagers smoking, mostly they're coming from their friends or parents or somebody in the family. Now, I don't think any store, any retailer want to sell to the underage. There's no money to make. It is like a $7, $8 pack. You make 25 cents, 30 cents a pack cigarette. Why you want to take a risk?
Thank you very much for your testimony.
Thank you so much.
Chris, I know that you've been working on just some ideas, and Councilmember Bankston as well, of, concepts around small business support. Can you talk high level of things that maybe you've been considering or talking?
You can go ahead first if you want.
Yeah. So for me, when I think about this, it is balancing, I think, the public health aspect, but then also the business aspect. And this has weighed on me heavy, particularly I think around our convenience stores and corner stores. And, you know, it is our responsibility. We talk about corporate responsibility a lot, right? Nationwide, all the big companies, what are they doing to give back to the community? But that question also has to be weighed and asked about those that operate in our neighborhoods, right? There's a moral responsibility that takes place as well. And so if 90% of our business is coming from a product that is harming the community that we serve, we have to think about, well, how do we change our business so that it is more beneficial for the community that we sit in? So one of the things that I know that I've been exploring and talking to my team at Economic Development, regardless of what comes out of this legislation, is how do we get our convenience stores, get all you folks in this room together to form a buyers collaborative so that we can have the purchasing power and also the supply chain in place to fill our stores with products that are beneficial to our community. Because what I do know is that you all are trying to do that, but you're not getting it at a price point that allows you to have a profit margin. We know that grocery in itself, there's already a small profit margin there to begin with. And so if we can think of going to say, I'm just gonna throw out Kroger because we're in the Midwest and everyone knows what Kroger is, but if we can utilize Kroger's supply chain and their purchasing power and their logistics to be able to fill our corner stores, for them not to be just convenience stores, but to be true bodegas like you see in other cities where they have products that you can get at wholesale prices. So then you have higher profit margins on those, that then our stores can become a net additive to our communities versus a net negative to our communities. And so for me, I think it's thinking about that long term, how do we broker that conversation? Now, the city's responsibility wouldn't be to be that logistics partner or to be that supplier or buyer, but we can, with our bully pulpit and our influence, bring that conversation together to figure out how do these convenience stores long-term, because regardless of what we do in the city of Columbus, whether that's nationally or even at the state level, we have to be preparing ourselves to think about if our business model is hinging on this one sole thing, it is a failed business model to begin with. And so for me, it's thinking about how do we make sure that you have a more sustainable business model and how can we broker those conversations for Columbus and make sure that it is a better, healthier ad. I think the other thing too that I heard clear through these conversations is that you as business owners, you think about not just yourself and your company, but it's the employees. And so if this does drive your business out and you have to close your doors, I think the concern is where do those employees go? And how do we have resources in place for those individuals? How do we have things in place so that they can be upskilled or get some type of certification that they can get a job somewhere else per se? Again, I think that the goal is if we work together, that no one should close in this. Now, we may all have to get messy and work together to figure out how we change our business model. I think it's unique for the vapor stores because all you do sell is vapor. That's a separate subset. But the goal is here, how do we work together to have a better product and a better business, not only for ourselves, so that we're more sustainable as business owners, but also that it's better for our community. So that's where my head is when we're thinking about how do we make our business owners whole, but also how do we take care of those employees who have to take care of their families.
Thank you.
I don't think she has a question, I guess.
Right now, the floor recognizes Rocco Bello. Rocco, don't get no claps, y'all. There we go. Thank you. 2 minutes, sir.
Thank you. Good afternoon, council members, panel. Thank you for the time to speak today, as well as all the time that's been allowed for conversation on this ordinance. I appreciate some of the questions that have been asked tonight. It's been one of my most frustrating parts being in the audience, is that I feel we are misunderstood. Let me clarify when I say we are misunderstood. I work for Vaporify in Columbus. We have 3 Columbus stores. I've been working with Frank and Sarah and James and others who own vape shops in Columbus. I don't really want to take a ton of time and get into a bunch of information that's already been mentioned. Frank can talk about the health statistics. That was part of what I had in here, but he's already mentioned that. What I do want to do is back the proposed consideration for maintaining flavored vapor product access at specialized and age-restricted retail businesses within the language of this ordinance. I feel that's the most important thing I have to say today. But I'll just give a little more insight into our business at Vaporfy that will be echoing some of what you've heard already. In the years since T21 has been implemented, we've continued to adapt our operation standards to the point to where now we also do not allow anyone under 21 to enter or browse in our stores. Similar to how Sarah lined out their process, we say hello, we introduce ourselves, we say, what are you in for today? After that information's divulged, we ask for ID. If someone does not have their ID or is not of the age at that point, they're asked to leave the store. Like Sarah said, if someone leaves the store as a group and one of them comes back in, we do not complete that sale. On our POS system, we have the opportunity to add notes to a customer's account. We have seen before someone come in, buy a product, go out, go to another car, hand it through the window, and come back in. On our POS system, we add a note to that customer's account, do not sell. So just wanted to offer some additional examples of how we take it upon ourselves as 25 to 35-year-olds to make sure that we're not putting our business in a bad light and that we are complying with the T21.
Thank you.
Thank you.
Thank you.
No.
Not a question, maybe it's for our staff. Do we have clear guidance yet from the city attorney on the thought of, again, separating vapor from tobacco? And either, whether it be from a licensing structure or just from a compliance structure?
Excuse me. At this point, we don't yet. We want to be very concerned, and we're very focused on making sure that things are properly defined, so that's very clear who falls into what category, and that's why we have to make sure that we're all set with the lawyers, and we're not there just yet.
Thank you.
Thank you, sir.
Thank you.
Christopher Vince. Give him a round of applause. Loving the shades.
Sorry, I have an eye disease, and that
Okay.
light is
Yeah,
that light
tear
has
it
been
up.
killing me the whole time. But
No, don't take them off. Don't take them off. No, keep them on. Keep them on. That's why I said I love them. There you go. You got 2 minutes, sir.
So anyway, thank you guys for allowing us, everybody to speak. Whether you're for this or against this, speaking is what everything, it makes it all better when we come together and we get together. But the biggest thing I want to talk about is, we keep talking about public health, and we talk about banning flavored vapors, but yet in all of this, we leave cigarettes, which are the original problem. Every one of these guys open their stores to stop people from smoking. That's why I opened my store, and I'll tell you right now, I would close my store tomorrow if you ban cigarettes, all of them. You ban all tobacco products, and you ban vape. But it never comes to that. It always comes to this flavored vaping thing because it's what is making the youth use it. But come on, you guys were all young. I was young. Any of you ever use tobacco? Did you use it because it was flavored? No, you used it because you were a teenager and you were experimenting. You know what I mean? Teenagers experiment. So if we close all these people's businesses and they don't have flavored vaping anymore, what are they going to do? They're going to experiment with something else. And that could be traditional cigarettes, it could be marijuana products, it could be crack, meth, who knows? We got to stop thinking that just because we ban something, it's going to stop youth from using it. And in that aspect, I would just hope that we can work together, like they said with the Toledo plan, where you keep vape shops to have it. But that doesn't mean, I'm not against C-stores or anything like that having other products. But if they can't, do their part to make sure it's 21 and up, then they should be gone. I'm for huge penalties. If you make a mistake, you sell to a youth. But I'm also for penalizing not the youth, but whoever's supplying it with them. My son is 16 years old, and he tells me, I'm not going to stand here and lie to you. Some people will lie to you. My son tells me, man, I see kids in school all day with Elf bars, which are these little disposables. And I'm not going to lie to you. He also tells me And I know kids that are vaping cartridges, which are THC, which are off the street. So like I said, it's there. But is it the youth's fault? No, it's whoever gave them that product. I think that's the person we should be penalizing. So if it's a store, penalize them. If it's a straw purchase, let's say they got a 23-year-old brother, then, you know, we gotta get that person in trouble.
Time.
Thank you.
So, thank you for your testimony this evening. So I know that probably for the last few business meetings, the conversation has really been centered around vaping specifically and our youth. But as the public health crisis has been presented to the city of Columbus, it's also a racial health equity conversation. And that is why we have been focused on menthol as well as a part of addressing this ban. But Edward, if you don't mind centering us once again around that component and why we're, and to that regard, why we're attacking menthol, if you will.
Absolutely. So I think for us as Columbus Public Health, one of our obligations is essentially to look at, what are the leading causes of mortality and are they disproportionately impacting specific groups within our community? When we look at those leading causes of mortality, it's heart disease, it's all cancers, it's accidents and injuries, followed by chronic lower respiratory disease and cerebrovascular disease or strokes. For us, we know that 4 of those top 5 are exacerbated by tobacco usage, save number 3. We also know that there is a disproportionate impact or usage in the African American community. As of 2017, we saw those numbers at about 160,000 smokers, and about 100,000 of them were African American. As we've spun that data forward, we know that the number of tobacco users has increased in the city of Columbus. I think the last numbers I saw, we were right around 180,000 as of 2019. We see that number of African American users also going up, and when I say that that number's gone up, the original number I gave you was comprehensive. The 180,000 was just adult users. So we know that that number could likely be larger. That 180,000 number does not include youth smoking. And we still see that disproportionate impact on the African American community, knowing that 85% of tobacco products consumed by African Americans in the United States are mentholated products. And that's the concern that we have because we do see African Americans dying at a higher rate from heart disease, at a higher rate from all cancers, at a higher rate from chronic lower respiratory disease, and at a higher rate from stroke. And so that is why we see a public health crisis. And to improve the health of that community, to address racism as a public health crisis, we think that this is an appropriate intervention.
Okay, thank you.
Okay. Now, this time, the floor recognizes Diab Ella. There you go, yeah.
My name is Diab Elan. I'm going to talk about something different. My business is different. I do not sell vape. I do not even sell cigarettes. But my sales is 100% tobacco. My customer, at least 30 years of old. And my other customer who smoking pipe tobacco, which pipe tobacco has been for 100 of the years, it's over 50 years old. My business, I have over 25 employees. With this law, with what you guys doing, I'm gonna be out of business. Me and my employee, I wanna be bankruptcy. That's what's going on. You guys can have a high ticket and double it for anybody breaking the law and selling to young people. Then after that, after a few tickets, take his license away. Why all of us have to pay for somebody making a mistake and selling to anybody underage? Thank you. That's all.
Thank you.
You have any questions?
Anyone?
What kind of retailer is he?
Sir?
Mr. Ella, what type of retailer are you, sir?
Cigar. I don't even sell cigarettes. I don't even sell vape. These people own business also, And I collect and pay for the state over $1 million of OTB tax and sales tax every year. And I have over 25 employees. They have no mistake. They don't do anything. Our customer, over 30 years old. And also, for several years, I have a sign in the door saying, if you under 21, do not enter.
Thank you. Council President?
So I'm assuming then that a portion of those cigars are considered flavored?
Handmade cigar, at least the cheapest cigar we have over.
I'm sorry,
$7.
CTV is saying that it doesn't count unless you say it in the mic.
You gotta if you
So-
can come back up to the mic.
It's 100% tobacco with infusion flavor. Okay, and at least any cigars cost over $5. But the kid's not going to buy $5 or $7 cigar. This is the cheapest one, just to smoke it. You know.
So-
And my customer, as I tell you, is over 30 years old. There is not even 25, because they don't start smoking cigar until they get older. The people.
Yeah. Well, I just want to make sure I'm hearing you, though, correctly. How much of your product is flavored, though?
Is over 50%.
Over 50% is
And
infused.
For example, the pipe tobacco is 100% flavored, which the older people smoking for retirement.
Yeah.
Also, the hookah tobacco, that cannot be without a flavor. And all the user for the hookah tobacco, they use it in their home. They're over 30 years old.
And is your shop a shop where you can smoke inside?
Couple smoke inside.
You have okay.
Yeah.
Okay. Mr. Maitland, can you talk about how we are looking at cigar smoking at this time? Cigar lounges.
Which is different than a hookah lounge?
Yes. So I think the question, sir, one of the things that we have been looking at are definitions surrounding Ohio Revised Code. You know, as I believe a previous speaker mentioned, Ohio Revised Code has a special distinction for retail tobacco establishments and retail vapor establishments. And that's based on selling 80% of your product being either vapor or tobacco, depending on one of those two distinctions. That's the question I would have, is that is your establishment considered a retail tobacco establishment by the state of Ohio?
Yes, sir. We have to be freestanding building and selling over 80% of tobacco, and we file for the health department every year for that.
Yeah, just to restate, yes, that if you're a retail tobacco establishment or a retail vapor establishment as defined by the state of Ohio, you are exempted from certain indoor smoking laws. To prove that you are, you have to file a form with the state of Ohio taxation so that you can receive this exemption, so that you can maintain the status to be separate from other entities who do not have this status.
Okay, thank you.
I think that the question, though, still is around the sale of, not consumption on site of, is what I think he was trying to get at, and Councilmember Favor was trying to get at.
There's a question of, I'm sorry, the sale.
So the sale of, in his case, infused flavor cigars, not necessarily the consumption on site. I know that the current legislation that we're looking at calls that out for hookah specifically, because it's, again, consumption on site. But what about in his case where his customer clientele is purchasing it to go?
I think, well, currently, as it is written, they would not be able to take it to go, as hookah would not be able to. The concern has been that, you know, kids can still use these products if they're taken somewhere else, even if someone is not allowed to sell them. They can still take them and go somewhere else. And so this ban is a complete flavored ban, so that they would not be able to sell them in any location. But there is not a distinction in what we have in the proposed ordinance so far, allowing anyone to take anything off premises. There would not be any products available with the exception of hookah.
Edward, do we have an accounting of how many cigar lounges are in our city?
We do. I don't have it offhand, but I know that it requires an exemption from the Ohio Department of Health to exempt them from the state's smoke-free indoor laws. So we can provide you with that information later this week.
Thank you. Thank you for your testimony, sir.
Thank you. At this time, the floor recognizes Bryce Krieger. Give it up for Bryce, please. Sir, you have 2 minutes.
Thank you. First, I'm a poor speaker. I'm sorry. I'll try to be good. The first question I actually have is, where do we draw the line with public health? If we're going to ban flavors, are we willing to, I know you said, are we going to ban pop or fast food because that's a public health risk also? Are we going to ban alcohol? Where do we draw the line with public health if we're going to take this step forward? And the other part of this, I want to toss out, I'm a horrible speaker. When I opened my shop 9 years ago, my average sales in nicotine were 3 milligrams. And it wasn't till recently with a company buying another company and advertising to minors that nicotine jumped up to 50 milligrams. And that's really when we saw the huge explosion with minors and nicotine and vaping, and specifically, that could be worked into a plan, because most traditional vapes that use a lower amount of nicotine are much larger products and can't be hidden at school like you go to the gas station and buy right now. So maybe looking at nicotine content might be a solution. That's all I got. Thank you.
Thank you. Thank you.
Assistant Health Commissioner, do you mind addressing? We got it.
Well, sorry.
Well, I was just going to ask Edward to respond to the question just around public health in general.
Certainly. I think for us, particularly as we address combustion tobacco, the thing that from a public health perspective is that this is a product that when used as intended harms its end user. And that's our general concern. And so I've heard individuals speak to issues of diet, fast food, sugar content. When used as intended, those products do not kill their end user. And that is why we are deeply concerned as public health about these products and their analogs. I think that when it relates to nicotine content, as the gentleman said, one thing that I would say is that we as public health, we're not ignorant to the studies out of Public Health England. I think we've taken a really strong look at them, because I think there is really compelling information when those are used as smoking cessation devices. And in those countries, the authorization that their version of the FDA has given has been, yes, use it as smoking cessation, turn the nicotine down, graduate it down, so that folks start to come off of these addictions and these products. That's the intended use. The intended use of the product in that context is to get you to stop using it altogether. And so I hope that helps answer some of those questions from public health's perspective.
I have a question for Chris, Mr. Maitland. One of the questions I've had along the way is, it is just my personal belief, I'm not speaking obviously for the city or any other council member, that the single-use vapes are different in who use them versus the cartridge, the large instrument that the gentleman just showed. We are having issues creating a difference legally between the two. That's one of the conversations we're having with the city attorney's office. Are we able to regulate amount of nicotine, to the last gentleman's concern? We've been focusing on the device. Is there, but not the actual content? Is that regulatable, if that's a word?
To be honest, I'm not sure, because really it would depend on the product, and if the product was available, the amount of nicotine that it had. I know we've had a few speakers mention the Toledo ordinance. I think one of the reasons why is that even though the retail vape shops can sell certain products, they are not allowed to sell pre-filled cartridges in Toledo. Those are specifically banned. So that is nowhere in the city of Toledo can those be sold at all, and that's one of the things that we have been looking at. If that type of distinction can be made, but I'm not an expert on the different products nicotine, but we can definitely look into that.
Well, and I would say that, so this conversation tonight is specifically to hear from you, from small business owners. Tomorrow we'll have a more expansive conversation, one that we plan on, because again, this part of the conversation is not easy for I think any council member, regardless of how they will vote on the final piece of legislation. And so we've been really asking very tough questions to our city attorney's office regarding these types of questions. And so tomorrow, I mean, we've put them on notice that we need to flush out publicly why they're saying that we can't make these designations, these distinctions, because that's important to me. Again, if I will have to, at the end of the day, follow. I believe that it's good policy to follow the city attorney's recommendation, but I expect a fuller explanation and conversation tomorrow at tomorrow's hearing with the city attorney, because this is something, and so our team would help suss out this part of the question. We've been focused on device type, information on product or so.
Thank you.
Thank you. At this time, the floor recognizes Abdullah Ansar. Give it up for Abdullah. Sir, make sure you're talking to the mic, and you have 2 minutes.
Thank you for the opportunity. Thank you, council members. We've been discussing this for quite some time now, and I don't want to repeat the same thing again and again. My thing is that, the city wants to ban it, and it won't be illegal. So if banning it, we already have crime at all-time high right now in Columbus, and we are short of police. So I was talking at the last meeting too, they said that the police, there won't be, if anybody would be selling it on street, won't be criminally charged with it. There will be a civil penalty. So that's like taking business from us who are gonna regulate it and check IDs and giving it out to the black market where they won't be checking IDs at all, and no tax revenue, no ID check, nothing. And even if we call the police that somebody's selling to underage outside my business, the police can't do nothing. They can't arrest them. And as many times we're going to call, at the end of the year, we're going to get a letter from City of Columbus. This many times you have called, you've been creating problems, and we need to shut you down. So how would city do about that? What would they do?
I really appreciate this question. Just as Council President Harden has indicated that we are pushing our city attorney to be as candid at the public hearing tomorrow about whether or not, where the legality rests with these pertinent questions that have been presented today. We have done the same, made the same requests with the chief of our police department, Chief Bryant, and her team as well. So they will be present at the public hearing. We know that we've had testimony from a few troopers that have indicated this as well. I think we need to be clear that we're starting to talk about two different things here. Here, yes, we are talking about civil penalties. But if someone is engaging in quote unquote, I hate to use the term, we're gonna say illicit activity, not black market activity, illicit activity, you're now entering into a realm of trafficking. That is a criminal violation that could be pursued in a number of different ways, whether that would be the local police or on a federal level. So the criminal rabbit hole that we have started to go down, we have touched base with our police department, our chief of police. She or one of her representatives will be present to talk more in greater detail about what this looks like moving forward. Please.
If I can also clarify, Councilmember Faber, when we're saying that it's not criminal, what we're saying is that police resources won't be used to target a group of teenagers smoking a vape on the corner. that doesn't mean, to your point, that someone who is explicitly, illegally selling something outside of your store, that there wouldn't be a consequence to that. When we say about the civil part, it's more on an individual case-by-case basis. That's what we mean by that, not necessarily for someone who's deciding to go that route.
You know how the state has really strict laws on underage drinking. So if city puts really strict, like charge minors who are smoking, maybe some kind, not felony, maybe misdemeanor or something, and put a charge on them, maybe that will help the compliance rate or underage smoking.
Well, I appreciate the testimony, and like all of these suggestions and ideas that we are getting, we're tabulating them and bringing them to the appropriate department to see if they're able to stick. Thank you.
Also, the city, we propose that maybe you should hire the fines if somebody sell underage, and that will raise the compliance rate.
Higher fines are on their way.
Yes, but
they are on their way.
But people who are doing good business, you're still banning them. So that does no good.
Yeah,
Thank you.
understood. Thank you, sir.
Thank you, sir. Right now, Ms. Randy Lynn Thompson, could you raise your hand? Right there. Stay right there. I'm bringing the mic to you.
Thank you. My original question was answered by Ms. Sarah in the hallway before I got to ask the gentleman in the center before you were talking about the benefits to community and what those are, short of being a parent. Being a parent, I have a kid, we all have kids. None of our kids vape, right? Nobody vapes, nobody smokes? Good. Okay, so benefits to the community. I have been in business outside of the city of Columbus for just now about 10 years. And I have at least probably 1,500 regular customers that are over 21 because you have to be 21 to come into our store. I'm outside of the lines of Columbus, but I don't care if you're carrying a toddler. You're not coming in here. You're not bringing your kid in here. So I had multiple questions. One was the benefits, and here we are. I serve 1,500 regular customers who do not smoke, and we're lifelong smokers that do not smoke over the age of 21. Besides that, I also wanted to know, what are we doing about kids that got caught with vapes in schools? Like, what's happening? They're not being charged because it's illegal. We've already raised it to 21. So I feel like T21 with the enforcements, and I know we're like up in the air about those numbers as far as like what we did for enforcement. So we have 863 tobacco stores in the city limits, and we did just over 1,100 checks last year. And I know we don't have these numbers, like, can we get these numbers? We're waiting.
I think public health.
Okay, so if not last year, then let's go to the year before. Do we have those numbers?
I'm sure we do. So give me
2020?
clarification. Where's your store?
Right outside, it's right west of Doctors West.
Okay.
In New Rome.
Okay, and where do you live?
I live in Grove City,
Okay.
just on the line of Grove City, but in
Gotcha.
Grove City.
Yeah, I think that public health absolutely has those numbers. Do you have them readily available that you can say them today?
Yes, and I
So-
think to your point, and after conversations with the folks from the Vapor Trade Association and comparing it to other licensing programs that we have, that's a commitment that I think is very easy for us to do, is to start publishing those numbers, as I mentioned, similarly to food inspections. So I think as a result of that conversation, that is going to happen. I think that as you ask for the compliance data, public health, over the life of the program from 2020 and 2021, actually didn't do any tobacco compliance enforcement. Columbus Public Health was in the midst of a public health emergency. So in 2022, we restarted that program. I do think we're just over 400 compliance checks deep because we've restarted those recently. So we are getting back into those. That is that
Years, we
commitment.
didn't do any checks?
No, we were in the midst of a public health emergency.
I mean, we can, maybe I can ask Grove City Council if they have numbers for you.
And so here is another thing that came to my attention as all of my people were over 21, and a lot of them have kids in high school. So last year, it came to my attention that DARE did a program at Grove City High School where they gave them their community service hours in exchange for vape shop stings, and they did not need parent approval to enlist.
Again, ma'am, I will take, if you want me to send a letter to Grove City?
No.
City Council or Grove City?
I'm just wondering
City schools,
what
we can do that.
the outcome of those things were.
I don't work for the city of Grove City,
Right,
so I can't.
obviously outside of the city
Yeah.
lines or whatever, but
Thank you for your testimony.
thank you.
I think that's the last one. It was. No, hold on. You don't have nothing to say?
At this time, that is all the speakers we have that signed up. And now, I turn it back over to Councilmember Shayla Favor.
Thank you so much, City. We truly do appreciate you moderating these conversations and bringing some lightheartedness to a very serious conversation. Before I wrap up, I want to provide an opportunity for Council President Harden to make any final remarks before tomorrow's hearing.
Thank you, Chair Favor. I have to give a lot of appreciation to Councilmember Favor, her team, the council's team, public health. One thing that I always say about our policy making is because when we make decisions, especially on hard stuff, we're never going to get everybody's approval of that final outcome. And so I don't seek everybody's approval, but I do seek folks' respect of the process. And so as we wrap up these series of small business conversations, I hope that the folks in this room, folks in the industry, have felt that council has taken this part seriously, the listening seriously. Regardless of where we get to, and it's not done yet, so I think that continued engagement over the next week as we go through this. The one promise I have, we will vote on this by the end of the year. We will vote on something by the end of the year. Is that the process is fair. And I have learned a lot tonight. I learned a lot at our first hearing. And so I am grateful for you. I think, like I said, tomorrow, there are real questions because this is the sausage making in policy, is trying to figure out how do we get to our end goal, which is to stop the next generation of tobacco smokers. That is my goal. I'll say that. That is my goal. And how do we do that with the least amount of greater harm to the community? And so we're listening to you, but we're also listening to our city attorneys. We're also listening to our Department of Health. And we are trying our best to get to a outcome that makes sense for this community. And so I am just saying thank you from that very first hearing that we stumbled out the gate. We already apologized for that because council takes listening very seriously. And so folks weren't able to get in the room. I've appreciated how you guys have engaged with us since then. And I think that hopefully you have seen a willingness for us to be in true dialogue, and that has impacted the legislation and will. So thank you.
And not yet, sir. Not yet. I'm sorry. Councilmember Bankston.
Well, one, thank you, Chair Favor, for your leadership on this, and thank you all for continuing to be engaged. It's starting to see some familiar faces now. And again, I think this is going to be down to the wire for us. There's been a new draft that council has put out there that we'll discuss tomorrow and continue to discuss. As the council president said, we want to take this up by the end of the year. As the small and minority business chair and economic development chair, it does not fall on deaf ears, the impact that this could have on our small business community, on the economics of our city as well. But it is also a balance between that and public health. For me, it is also about the next generation. I do have a son. He's 18 months old, and I do think about what type of city he is going to inherit and grow up in. And so I just want you all to know that what comes out of it will be balanced. There's great ideas. Even every time we have one of these conversations, there's more ideas, and that we shovel off and try to see what can happen. And so you know tomorrow, and we have been trying to put the screws to our city attorney to give us definitive answers, but also for us to push the envelope. I am one of the folks on the dais that says, let us get sued. If we want to try something innovative, our job as a legislative body is to come up with what we think is best. Our city attorney is the one that has to go defend that in court. And so it works in that push and pull. So I just want to echo the thanks of you all staying engaged in the process. And again, I can't reinforce it. This is your livelihood. I understand that, and I know that comes with passion. And I know that you all may think that we have predetermined a decision here, but that is not the case. And so I appreciate you all for continuing to show up, to continue to take us at our word that we are listening. And I hope that you see the changes that keep coming out of this legislation means that we are listening. But change is hard. Progress is hard. And I often say that progress is the tension of honoring where we've been and making the sacrifices that are necessary for the future that we want to build together. But that key in that tension is that it has to happen together. And so even though this has been frustrating, even though this has been a long process, I hope that you all have enjoyed it as much as I have, because I'm a policy person and I love this type of conversation. But true policy and true progress doesn't happen at City Hall. It happens in rooms like this. So thank you all for continuing to show up. This is not the end of the conversation. I know as we loom closer to the end of our session as council, decisions have to be made, but we're continuing to talk and continue to be open. So thank you again for showing up. And thank you again, Chair Favor, for your leadership.
Yes, thank you so much, Councilmember Bankston. And there's been several call-outs about pressing our Columbus City Attorney's Office. I want to reiterate once again that we have heard you all and the concerns that you have about an illicit market popping up in Columbus. And so I just want to reiterate that we are pressing our safety department as well. So you'll hear from both of those departments, as well as Columbus Public Health, and obviously Small Business and Small Business Department will be present and represented by Councilmember Nick Bankston. I want to thank you all once again for being here and engaging in this process. You mentioned that we spent a lot of time together, and I've said it before. But if our minds were made up, there would be no need for us to sit up here and take these darts from the small business community. And so I greatly appreciate your time and your willingness to educate us along the way and to share these ideas and this feedback that we've received. And as you can tell, it's being reflected as we continue to modify what was originally presented by Columbus Public Health. The proposed amendments are live. The legislation is live. You can view it at www.columbus/tobacco. In the draft, you will see all of that feedback that has been discussed over the past month and a half. Once again, it is a draft. Our city attorney's office continues to debate those exemptions that have been called out again. Adding to the list for discussion that came up tonight, I want to note the cigar lounges, and regulating the level of nicotine, which has not been discussed thus far. So tomorrow, Thursday, December 1st, will be the second public hearing, 5:30 p.m. in council chambers. If you want to provide testimony, Anissa, is she in the back? She's in the back. She can give you the speaker slips, and you can fill it out tonight if you want to provide your written testimony or spoken testimony as well. Additionally, our public comment period remains open, and you can email flavored tobacco at columbus.gov to share any additional comments. Thank you again, and that wraps up our third and final business meeting. Have a wonderful day.
Good evening.